Hi, beautiful people. So I'm Dr. Roy, as most of you know, because most of you getting this newsletter are patients of mine. And I wanted to talk to you guys about some leading edge testing that can help us to help you. So for our cancer patients who are in treatment, one of the things that you and I and your oncology team can struggle with is figuring out what is the most accurate and precise drug or natural therapy to pair with your specific type of cancer in terms of how it's behaving in your specific body. Now, most of you may be aware that there is testing called genomic testing that can look at the kinds of mistakes that your cancer cells are making and allow your doctor to choose treatments that are more targeted to those mistakes. There's a couple problems with that. So one is oncology is a conservative field and it's slow moving. So while that genomic testing is now available and is usually done when you're first diagnosed, oncology isn't super set up to use that data because they have to start with first line treatment. What do I mean by that? So let's say you're an early stage breast cancer patient and you're scheduled for surgery, chemo, radiation. Your chemotherapy for a hormone positive, HER2 negative breast cancer is usually going to be adriamycin, cytoxan, taxotere, or ACT. That's considered first line treatment. And that first line treatment is kind of set in stone. It's set out in these guidelines that are published by the government after consulting with the country's top cancer centers. And then that treatment is what every medical oncologist kind of follows when that patient is diagnosed. However, they do also, when they do the surgery and they take out the tumor or a portion of the tumor, they do test that tumor for the kinds of mistakes it's making. They just, because they're kind of locked in to using first line treatment, they may not use that data to choose a different type of treatment that's more targeted to you. Now, why would that be? A couple of reasons. One, by law, they have to use first line treatment. The field hasn't changed enough, and that's really to protect patients from experimentation. But the field hasn't changed enough for so a doctor to step outside of those NCCN guidelines and use a non-proven or a less proven or even a targeted therapy that's specific to you without trying first line first. The other problem is that over time, if this person is not an early stage breast, let's say they are later in their disease course and they continue to need treatment, those cancer cells may change over time and adapt to a hostile environment in which you're fighting them by changing the gene alterations that they're expressing. So that genomic testing needs to be repeated in order to really have precise information to treat you. So all this being said, what we're doing now at our practice is we've partnered with a company called Tempus. Tempus is a little bit late to the market. You might have already heard of Foundation One or Caris. Those are organizations that got into the hospital systems early and have established this testing early, which does not mean that they're necessarily better. It just means they were first to market. Tempus is kind of positioning themselves as the Apple computer of genomic testing. So they want to make themselves accessible and easy. And one of the benefits of working with Tempus is they're willing to work with us. So we're a busy practice. So they're motivated for that reason because they want the data. But two, they want to make this kind of testing available to everybody, including people who are seeing naturopathic doctors. So that's a great part of the culture. It tells you a little bit about the culture of Tempus. The way that Tempus works is they will take a blood sample from you, and then they will use that blood sample to test for different kinds of gene alterations that the tumor that still might be in your body is kind of shedding or expressing. They'll generate a report from that blood work that tells us what gene alterations are expressed the most, and then ranks them from most to least, which gene alterations we currently have drug treatment for, which drugs would be more specific and precise for your type of cancer, and also what clinical trials are available for you for newer drugs in your area at any hospital system, not just the hospital system that you're at. It also gives you a lot of information to research and understand your specific gene mutations. Now, the benefit of having this test and this information is I am also, and our fellows are also educated in what natural therapies we can combine with those specific alterations so that we can make your natural therapy treatment or your supportive care treatment also more precise. For example, if a person has a P53 mutation, that's sort of a border control mutation where the cell gets repaired when it makes mistakes, we can partner curcumin as an extract from turmeric in high doses combined with fat and piperine to target that mutation. Of course, if it's not contraindicated with your current treatment. So, and you're going to tolerate it. So it's complex, and I don't want to make it any more complex than it is. I just wanted you guys to know that, one, we have this testing now available for all of our patients in treatment with current disease, and that we are advancing or modifying how oncology uses this testing so it is more actionable and precise for our patients. We can advocate with oncology for you in terms of drug treatment, but we can also make your natural therapy more precise as well. Now, these tests are very expensive. However, Tempus has agreed to absorb the cost for our patients because, again, they would like that data. It helps them to broaden their genetic or gene database. So we have a financial assistance program with them where if you call the number after signing consent with us, they will qualify you for financial assistance. And usually that means for most of our patients, there's no out-of-pocket cost. That's huge, obviously, in this private pay world. And one of the things that we're not doing is we're not ordering the testing if you don't qualify for financial assistance because we don't want to burden you further. If you do qualify, then our practice does have a nominal fee associated with processing, interpreting, and treating to the test, but it's nowhere near the fees to see me or anybody else in the practice. So we want to make it, again, very accessible. We want to make it very usable, and we want to get the best outcomes. One of the things I think both you guys and we struggle with is using standard of care in first line and second line and third line treatments in cancer means we usually, or not usually, excuse me, we sometimes run through drug treatment that is not as effective as it needs to be because how lung cancer behaves in Joan is very different from how lung cancer is going to behave in John. So lung cancer in Joan may behave like a colorectal cancer, for example, or a colorectal cancer in John may behave like a prostate cancer in Don. So it really shows up individually, and that's why it's so important to us that you get this testing. So I'm doing this video because we have introduced this program and we are sending out consent, and we're finding that patients are a little bit confused about consent. They're not getting it back to us in time, and we're not able to get this kind of really fantastic technology to you. So I'm hoping that this helps to educate you and motivate you to ask us about this testing, and also to follow through when you get an email with us on consent, so that we can get this testing to you free or at low, no cost, and get you the best outcomes possible, because it's our life goal to see you live a cancer-free life and live the life you deserve. We'll talk to you at our next newsletter. Until then, be well.